Hey guys, can you see me, hear me? A very good evening and a Merry Christmas. I hope you guys are doing good. Am I audible and visible? I hope I am. Yes. Okay, let's start. So we are back to the same series. We are looking at what's happening inside the lab. We had a couple of sessions before. We had a look about normal light microscopy, fluorescent microscopy, and also a little bit of frozen section yesterday, right? So I'm going to take it forward today. As you can see the name, we're going to look at fixation and processing, right? Hello, Buck. Fakti, hope you're doing good. Merry Christmas to you. So we did read a touch base about what is fixative, right? Because what we saw in the previous class was for any tissue, if I take from my body, the tissue will decay. For that, we use something called an fixative, like the same fixative what you use in a dead body, the embalming fluid formaldehyde. That's the commonest fixative used for almost every histopathological tissue, right? So now the goal is simple. You take a biopsy. Could be a biopsy from the breast, from the intestine, or from the brain, right? Biopsy will be like a chunk of tissue like this, right? You must have seen biopsies being taken. If not, when you go to surgical procedures, you will see them, right? It'll be a chunk of tissue. They'll take a bit of piece of my any part of the body, which is pathological, to see what's the problem. This tissue has to get converted to this, right? Let's say you have a bread slice, right? I can say that normal bread, the texture of a biopsy or a tissue will be like that of a normal blood, like a bit of a spongy thing, right? Rarely it might be very hard as well, right? So is it possible for you to cut a normal blood into 5-6 micron thickness? It's impossible, na? Because it's soft and spongy. You cannot cut like that. I need it to be a little bit firm so that I can cut, right? So the first step we already know, from this to this, how do I make it, right? Okay. Hi Shubham, see you after two years. Next year you'll join MBBS. After that you'll see you for sure, right? So from this, what happens is the first thing what we do after taking a biopsy is putting it a fixative. We know that what is the purpose of the fixative. We have already discussed, to prevent autolysis and to make sure there's no superadded bacterial infection, right? Then it's a very soft and spongy tissue. I need to make sure I can cut a 3, 4, 5 micron thickness, very, very thin. Only then you can stain the biopsy like this and you can see the cells, because with a thick tissue, I cannot see the cells, right? So now it has to become like this. For this, I need to process the tissue. Processing is very, very important as the fixator, right? Generally, fixing and processing tissue are more or less together learned, right? Both of them are very, very important here. Only then I'll be able to get a tissue like this. INICT had asked questions previously based on the tissue and process, right? The entire thing, whatever we are seeing, the lab medicine is something which is primarily focused for an INICT, AIMS, GM or PJ type of an exam. NEET exam, it's not that much asked. Maybe if in future it comes, it'll help you for sure, right? Now, we have something called an automated tissue processor. If you get your chance to go into the histopathology division of your college lab, go and see, there'll be jars like this. It's an automated tissue processor, right? It keeps on moving up and down, up and down, up and down. I just once go and see. Because there are lots of jars here. There are lots of solvents, lots of containers here. It might have 50, 60, 70, 80, 90, 100% of alcohol in serial concentrations. It'll have a component called xylene. It'll have a component called formalin. Formalin is a fixative by default, right? So what happens is, every day the biopsy comes, the flow is simple. The biopsy or the surgical specimen comes to the pathologist. Once the surgical specimen comes, the pathology PG or the assistant does something called grossing. Grossing means what we do. Let's say you have a sample of hysterectomy, fine, for a fibroid uterus. Okay, let's say it's a cut open surface of hysterectomy with a fibroid uterus. I need not go and look at the entire uterus in the microscopy, right? I need only this part. So grossing means the pathology resident or the pathologist takes a slice of it and says, this is the only thing which has to be fixed. And this will be put into a plastic cassette. We call it a cassette. Once it's put into a plastic cassette, this piece of a tissue, this will be gone into the tissue processor. In tissue processor, what happens? Yesterday, if you remember, I told that for a normal processing of tissue, for me, it takes like 17, 18 hours. That's what this tissue processor does. Though we call it fast, still in spite of that, it takes lots and lots of time, right? Because it's a very slow process. And it has every step, what you see in the tissue process is important for us, right? First, the tissue process will have multiple containers like this. For every container, we will be specifying the number of duration of minutes, like in one it might be 15 minutes, one might be 13 minutes, one might be 14 minutes. We'll fix it so that it goes, stays there, After the timer alarm goes off, it moves, rotates, goes to the next. Moves, rotates, goes to the next. That's how it goes, right? The first and the foremost thing by default will be in formaldehyde, in formalin, right? I'll just take a detour here and tell you what are the other fixatives you have to know. The most commonly used fixative is formaldehyde, or if the option has NBF, it's the same. NBF is neutral buffered formalin. It's the same formaldehyde, but a little bit of buffering solution, right? We have something called as you guys must have done peripheral smear in your first year, right? Have you done? You must have done it, right? What is the fixative use? The stain is Leishman stain, right? For a peripheral smear, I'm writing PS. We use acetone-free methanol, okay, as a fixative for a peripheral smear in a Leishman stain, right? Okay. Facti, can you rephrase your question? 5 to 10 minutes to cut to the tissue means? Can you tell me what you exactly asked so that I'll be able to better answer your question, right? Acetone-free methanol is a fixative used in Leishman stain. Normal Leishman stain, what you must have done in your first year, second year, everywhere, we use acetone-free methanol. Normal peripheral smear, right? Next, you have something called an electron microscopy. In that, we have fixative called as glutaraldehyde. Here, formaldehyde might not work. I have glutaraldehyde, right? Or we have something called an osmium tetroxide, right? Most often the used one is glutaraldehyde by default. In frozen section, what we read yesterday, we don't have any fixative. There's no fixative used. The only fixative here is a temperature. It's a freezing point, minus 25 to minus 30, fine. Doom scroller on the loose. Okay, nice name. See, I have a WhatsApp group for the Nisheba students. Please ping me here. I'll add on to the group. Any doubts you have, you can ask me in the group, fine. Okay, perfect. Okay, Facti, what happens is, there are multiple containers here, right? So based on the limit required, for example, I need the tissue to be stored in formalin for 40-50 minutes, 40-50, 10-50, or sometime the last step might be like 10-15 minutes. We will set the alarm such that it goes, stays there, same place. If you see, there's a hand, these are like your what to say, these are like your in your childhood days you must have seen something rotating, no? The children play sitting on the horse like that. They move, they rotate, they move, they rotate, right? So that once the time is over, it will be pulled up, allowed to drain, rotates, and goes to the next chamber, right? That's how it goes to the entire night. It keeps on processing, right? That's what it does, right? Okay, let's come back to this. There's no fixative for your frozen section. Temperature is the only fixative what we use here, right? There was a solution called as buoyant solution. I hope they don't ask it anymore because we have discarded it because it has mercury, which is definitely toxic. Buoyant solution was useful for testicular biopsy. Yeah, merry-go-round. Didn't strike me the name. Okay. For a testicular biopsy, we use buoyant solution. These are different fixatives, simple fixatives you want you guys to know, right? Perfect. Done. Okay, great. So now we know about the fixative. So what else is there in the machine? What all steps are required, right? So now I told you one of the basic problems why I need this processing to happen is the normal biopsy is a little bit softer. I cannot cut something into 4-5 micron thickness when it's softer, right? So can I say I should make it harder? Yes, no, maybe. Yes, by default. I have to make it harder. How do you make it harder? So now the goal is here. We have to understand what else will be there in the tissue processor. What else fluid will be there in the tissue processor? Everything has a very specific requirement. You have to make it harder, right? So to make it harder, any substance, to make it harder, what will you do? Normal bread, how do you make it harder? Can I say you pickle? You put it in the sun, it will become harder, right? In other words, can I say by dehydrating any tissue, I can make it harder? Yes or no? You can definitely make it harder, right? This tissue processor has multiple use cases. The first thing is it helps in fixation. The first thing which you already know, there are 2 of the cans which will have formaldehyde, which will help in fixation and proper percolation of the formaldehyde into tissue. The next is I have to dehydrate. So dehydration is the second important step. We'll see how we dehydrate everything very soon, right? Now let's say I have a tissue, I've completely removed the water out of it. Can I say it'll kind of have empty spaces, or in between the tissue there might be, we'll use dehydration using alcohol. Alcohol will go and stay inside. Yes, I have to remove the alcohol, right? Because if alcohol is there in microscopy between tissues, I'll see alcohol. I don't want that, right? Next, the third step comes for me is clearing. Okay, we clearing nothing means clearing is not a step just to remove alcohol, because alcohol is the one which we use for dehydration, right? That's clearing. We'll see what happens in clearing, what molecule is used in clearing, right? Next is I have cleared now. So now the tissue was first like this with water. I remove the water, and inside the tissue I had little bit these blue dots. Assume that these are alcohol, right? These blue dots are alcohol. The tissue is there, and I have a little bit of alcohol here. We said that alcohol is not good for me, so I use a chemical we'll see soon to remove the alcohol. Now what happens is it's the same thing, but unfortunately with empty spaces. The place where alcohol was there, it is cleared. I cannot have empty spaces also, right? So I need to put something into the empty spaces. That's a fourth step, or we call it impregnation or infiltration. That's the fourth step. We impregnate or we infiltrate with wax. Next time when you go to a pathology lab, they will have lots and lots and lots of wax. Will be like pellets, tiny round thing. It won't be like a candle wax, like a candle. It will be like tiny pellets of wax. So what we do is we have the same tissue. Wherever the space were empty, I use molten wax into it so that it seal the place. Okay, so I'm just going to seal the place with molten wax. The idea is simple. The tissue should not break when I cut it. Hi Tara. Okay, that's the reason I have these 4 steps. These are the 4 steps which are done in tissue processor, which takes time. That's why a normal tissue processor requires time, right? Now let's see who does each one of these steps, right? The first thing, like I said, the most important thing for me is dehydration. Dehydration is very simple. Okay, so we use simple alcohol to dehydrate. Merry Christmas to you as well. Okay, we just use a simple alcohol to dehydrate, to remove water from the tissue completely, because I need wax to enter. Can I say wax and water will never be miscible? You must have seen, na? Even a normal candle, you put water on top of it, it'll go and spill over, right? They won't miscible. Wax is hydrophobic. They are water hating people, right? The first thing is I have to dehydrate. How do I dehydrate? So now I have the tissue. The best thing to dehydrate is I put this tissue into alcohol. I don't put this tissue into absolute alcohol directly, because it will suck out the water like anything. That will shrink the tissue. I don't want to shrink the tissue. Shrinking will destroy my architecture. So what we do is first I do into 70% alcohol. It will remove a little bit of water. Then I put into 80% alcohol, a little bit more of water. Okay, then I put in 90% alcohol. Then I put into 100% or absolute alcohol. This is called as a gradation. Gradually increase the alcohol strength. So I need to do it gradual. If it's sudden, right? If I say I put the tissue directly into 100% alcohol, which is wrong, because it will shrink the tissue. Completely shrink the tissue and cause excess hardening of the tissue, so that you cannot take a proper biopsy, right? So gradual gradation of alcohol you put, it will slowly remove water. It will automatically remove water, and slowly, when you come to the closest 100% alcohol, whatever spaces had water droplets will be filled with alcohol. Slowly and steadily, it will be filled with alcohol. So I have a tissue here, which is initially filled with water. Now slowly and steadily, all these spaces are going to be filled with alcohol. This is what happens. I'll go back to the machine again. So I'll have one container with 70, 80, 90, sometimes 2 containers 90, and 3 containers with 100. So I'll have multiple containers. In each of the container, it stays for 30-40 minutes. Goes again, goes again, goes again. The time is actually determined on how many tissues I put. In one basket, I can put many cassettes. If I have only one cassette, I can do it fast. We call it fast processing. There are many. I need to give time for alcohol to go into every tissue and remove the water, right? So it might take time, right? So once that is done, now what I have is I have a problem. I have alcohol inside the tissue. Unfortunately, when I use staining, alcohol will be a problem, no? Because alcohol will change the acidic basic nature, and it will be a problem for me. I don't want alcohol, right? The next step, what you do is clearing. This came in an exam. If your pathology Viva, if they are more keen into you knowing the processing, what happens, they may ask it. Process of clearing is simple: to remove the alcohol from tissue. what was there previously in the tissue, I have to just remove the alcohol from the tissue. That's called as clearing. Because only when I remove the alcohol, I can easily put inside wax. And the commonest used clearing agent called as xylene. Okay, xylene is the commonest used clearing agent. Again, if you cross the histopathology lab, you might have a smell of a varnish smell. Next time in the processing machine, go. It has a turpentine or varnish kind of smell. It's xylene. It's very, very, very efficient. It will remove any tiny trace of alcohol present. But the problem is it's toxic. And it should not be exposed for a prolonged time. If it is exposed for a prolonged time, it will cause brittleness, right? It's very good. It's very, very efficient to remove alcohol and will replace it with the xylene, right? The only issues are it's toxic compound. So the fumes should be limited. There are techniques in the lab to measure the toxic fumes. Based on that, the entire ventilation, everything should be properly orchestrated. And the only thing is, if it's used in excess, it might cause brittleness. The tissue will start breaking. That's the reason the timing is important. That's why these tissue processes are automated. I don't go and say press, change. I set it and go. So that there's no overexposure, there's no underexposure, and the amount of exposure is well researched and is put for, right? We have few alternatives for xylene. I can use toluene also. Toluene is a decent alternative. We can use chloroform as an again as a clearing agent. Bit slow but decent. But normal chloroform, what you must already know chemistry, right? Okay, the same thing. Fine. We can use that also, right? So these are something which we can use, right? Now xylene is done. So what happens is same tissue which had alcohol in the center was removed, cleared by xylene. So I have empty spaces now. So what do I do in the empty spaces? Yes, fact, it's toxic. It's an occupational hazard, so it should be taken care of it very carefully. Fine. So next step for me is the infiltration by wax. Okay. So what we do is we put the same tissue basket into a container which has wax in the molten state, right? So the melting point of the wax. So here in the basket, you'll have wax in molten state. It'll be around 50 to 60 degrees centigrade. Well, 55 to 60 degrees centigrade will be the temperature, so melting point of the wax. If I increase beyond that, it'll be in molten state, right? So simple paraffin wax. It'll be like a pellets, tiny pellets. You'll have paraffin wax, and that will be there. You put the entire tissue cassette into it. So slowly and steadily, the wax, the molten wax will enter and fill the empty spaces in the tissue. So it's a wax which is there in the empty spaces, it will be filling, right? So let's say why I require this is, let's say microscopically I have a gland. Okay. This gland is empty in the center. There's a lumen in the center. But if it's water or alcohol or xylene, I'll have a problem. So what I do is slowly remove it and replace it with wax. The good thing about wax, no, when I make a section and I start staining, wax will dissolve because of the temperature involved. So the empty space will look like an empty space. How it was inside the body, the same way it will be present here as well. So I can have a perfect diagnosis, right? This is how it will be, right? So once it is done, so what we'll have is a tissue which is like this, and we have something because the cassette will be put on top of this, and then this goes to a process called as a microtome. Okay, we'll talk about microtome in the subsequent classes. In microtome, we cut them into thin slices. It's like a cutting machine, like what we saw in the frozen section. There is a wheel, right? The same way, right? Thin slices between 4 to 10 micron based on the test what we do. The ideal one will be 4 to 5 micron. Sometimes like a congruent stain or something, I would require a thicker section, right? Then you do a routine histopathological staining, H&E staining, right? We have Eosin and Hematoxylin. That's how you stain. You do microtome and then you stain, right? Hematoxylin is a basic dye which will stain the nucleus pink, blue to purple, and Eosin is an acidic dye which stains the rest of the cytoplasm pink in color, right? This is what we do, right? So Hematoxylin, which is a basic stain, which will stain the nucleus, nucleic acid, right? Base will obviously bind to the nucleic acid, and Eosin, which is an acidic stain, which will stain rest of the cell. Most of the cell cytoplasm, everything will be stained by Eosin, right? This is what normally happens in case of a routine tissue processing, right? Just a quick recall. we'll go and definitely see. I'm taking tiny bits and pieces because these are not hardcore topics of CBME. But at some point of time, we'll be definitely moving towards entrance exam, where if you're a very aspirational student wants to get into INICT like an AIMS or a PGI, this might come handy, right? Slowly and steady, little by little, we'll read. We had a problem, a tissue to a slide. How do I do it? First, I use a fixative. Then I have to convert that into a harder tissue. For that, I have to remove the water. I did it with the help of your alcohol, gradations of alcohol. Suddenly, if you put, it will become hardened. That's why 70, 80, 90, 100, we use that, right? Then the alcohol is there. In order to remove the alcohol, we have a step called as clearing, and the most common clearing agent uses xylene. It's like a turpentine like a thing. You put xylene, alcohol will remove, and xylene will be there. Then I cannot have xylene alone because xylene for a prolonged exposure will cause brittleness. So we take from the xylene and put it into wax. So wax will go into the gaps and will replace xylene. This we call it infiltration or impregnation, right? So the wax goes inside and will completely replace. After it, you take the tissue, you put it into a mold and you cut into tiny pieces or thin slices using microtome and you stain the slide, right? So this is the entire process of tissue processing and fixation, right? Clear? 20-25 minutes every day, that should be more than enough. Slowly and steadily, will definitely evolve. Okay, guys, any doubts? Do let me know. If not, we'll see you soon. And then, Merry Christmas. And hope this year, the new year, will make everything in your life amazing. No doubts? If no doubts, see you soon.